The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, hey everyone, this is Jonathan from Go to Health. Here we are in March, and we don't want to think about it, but tax time is coming up. And I always like to say we need to take care of our financial health as well as our physical and mental health. And that's where Monarch software comes in, the all-in-one personal finance tool designed to make our lives easier. Simplify your finances with Monarch. Monarch is the all-in-one personal finance tool designed to make your life easier. It brings your entire financial life, budgeting, accounts and investments, net worth, and future planning together in one dashboard on your phone or your laptop. Feel aware and in control of your finances this tax season and get 50% off your Monarch subscription with code GO2. Your mental health is improved when you can see your entire financial life, budgeting, accounts and investments, net worth, and future planning together in one dashboard on your phone or laptop. I'm reviewing all my revenues and expenses from last year in a beautiful clean dashboard, and I'm about to share it with my accountant to prepare my tax return. That's a great load off my mind. Monarch keeps me focused on planning and hitting financial milestones, not just tracking my spending. Monarch gives me a complete picture, budgets, debt payoff timelines, savings goals, net worth, so I can make decisions that actually move the needle. And surprise, Monarch has all these AI tools built in, offering me 24/7 access to a financial coach, insights into my spending, and weekly recaps so I can stay on track. Monarch keeps me focused on planning ahead and hitting real financial milestones. As a Go to Health listener, you can ease your mental stress with Monarch. Achieve your financial goals for good with Monarch, the all-in-one tool that makes money management simple. Use code GO2 at monarch.com for half off your first year. That's 50% off at monarch.com, code GO2. Help take the stress out of your life with Monarch. Here is Jonathan Marks. Hello again, everyone. This is Jonathan Marks from Go to Health Media. We bring you evidence-based information in healthcare by promoting the work of expert health practices, nonprofit organizations, and companies. You can subscribe to our show at gotohealthmedia.com. So today's topic, are you on Medicare or do you know someone on Medicare? If yes, listen up. There's huge good news changes taking effect in January 2025 to reduce your prescription costs. Medicare Part D enrollees' out-of-pocket spending on prescription drugs will be capped at $2,000 starting in 2025. This is due to a provision in President Biden's 2022 Inflation Reduction Act that AARP championed and is a significant step towards lowering prescription drug prices for nearly 55 million Medicare Part D enrollees. A new AARP report shows that 94% of enrollees expected to reach this cap will see an average saving of $2,500 in 2025 nationwide. The report also analyzes state-level data showing that Part D enrollees will see lower out-of-pocket costs averaging $2,500 or more in 22 states. So we want to welcome back to our show our expert, Leigh Purvis. She is AARP's Prescription Drug Policy Principal, where she heads the organization's work on prescription drug issues and is a recognized expert on prescription drug pricing and coverage. Her work focuses on improving prescription drug affordability and accessibility for older adults. She has testified before Congress and state legislatures on behalf of AARP and speaks frequently on a wide variety of prescription drug-related issues. Welcome to the show, Leigh. How are you today?
I'm doing well, thank you, and thank you for having me.
Sure. So let's talk about the new developments in prescription drug prices for 2025. This is really exciting.
It really, truly is. As of January 1st, 2025, there is now a new out-of-pocket cap for people in Medicare prescription drug plans of $2,000, meaning people in those plans will no longer have to spend anything more than $2,000 in 2025 out of pocket. And that's part of a lot of much bigger changes as part of that 2022 law called the Inflation Reduction Act that includes a lot of different changes that will help reduce prescription drug prices and prescription drug out-of-pocket costs. And for people in Medicare, it's particularly important because previously people in Medicare prescription drug plans did not have any limit on their out-of-pocket costs. And we
Hmm.
know that some people were spending upwards of $10,000 per year.
So this is really a huge, huge savings for everybody.
Very huge savings. It's actually something that's incredibly important to AARP because we've supported it for a very long time. And so we've been doing a lot of work to try to figure out exactly how many people are going to benefit. And our most recent report took a look at people in prescription drug plans who are going to hit the cap in 2025 in a context that included their premiums. And what we found is the savings are still there. About 95% of people who hit the cap in 2025 will see total out-of-pocket spending reductions on average of about $2,500. So really a meaningful impact for the people who are hitting that cap.
So this is a reduction of what they spent last year.
That is correct. And that includes their
That's
premiums, which of course change every year. So yes,
that's
it's a very
amazing.
big, exactly, a very big change, a very big important change, and a lot of savings for people who need it.
Now, is this pretty uniform across the country? Does it matter where you live, or do you don't have to worry about that?
It is pretty consistent across the country. We're looking at, again, about 95% of people in prescription drug plans who hit the cap will see total savings in their out-of-pocket costs. There's some variation, but it's pretty consistent from state to state. For example, in about 22 states, those average savings are $2,500 or more. So you could see more in savings. You could see more people in terms of the share of people who will see savings, but it's pretty consistent. This is something that will help a lot of people and the vast majority of people in those prescription drug plans.
Great. And when I go to the counter, how am I going to feel these savings? Or is the pharmacist going to say, "Oh, that's free," or how's this going to feel? How's it going to work?
That's a great question. So, as far as people in prescription drug plans are concerned, they don't have to do anything. They just have to go to the pharmacy and fill their prescriptions, and their Medicare prescription drug plan and their pharmacy will take care of the rest. And yes, you're absolutely right. Once they do hit that cap, they will be told you don't have to pay anything for your prescription drugs. And in fact, we've already heard from people who have already hit the cap as of the middle of January of this year, and
Wow.
they have walked away having paid nothing at the pharmacy.
Well, they've hit the cap already. That's a lot of drugs, I guess. Well, and what part has AARP played in having this come about?
AARP has strongly supported a lot of efforts to try to reduce prescription drug prices and out-of-pocket costs for a long time, and was engaged in some pretty heavy advocacy work for the few years before the law passed in 2022 to make sure that Medicare beneficiaries were going to see some savings like they are seeing now. The out-of-pocket cap was definitely a big part of our efforts, and the fact that it was ultimately included in that law was a really big, important win for us.
Great. And I'll bet you know about this next topic, which is I just read in the paper this morning that President Biden announced 25 new drugs going into price negotiation, and that's part of the Inflation Reduction Act. Can you tell us more about what's happening here?
Absolutely. I'm happy to talk about Medicare drug price negotiation. That was another really big solution that AARP supported to try to bring down drug prices. Every year, we're going to see the Medicare program selecting drugs that cost the program a lot of money. So the first 10 drugs were selected previously, and their prices have already been negotiated. And what was announced today was around 15 drugs selected for negotiation.
Right.
And those prices will be announced by the end of this year. And this is something that will continue every year going forward. So these drugs that cost the program and its beneficiaries a lot of money will see lower prices once they've been negotiated. And that, again, is a big source of savings for people who need it.
And do we expect this to continue under the new administration, or can there be changes to this?
It is certainly our hope and expectation, especially after all of the work we put in to get this law passed, that the incoming administration will continue to implement this law as it was intended to make sure that the millions of Medicare beneficiaries are able to continue benefiting from lower prescription drug prices and lower out-of-pocket costs.
Great. And this was a law passed by Congress. So would it take an act of Congress to change the law? Is that the way that would work?
Presumably, that is how it would work. But again, our hope and expectation is that will not become an issue because, again, we're talking about tens of millions of people living on fixed incomes who really need access, affordable access to the prescription drugs that they need. And so this law goes a long way towards helping those people, and we want it to remain in place.
And when people are on these kinds of prescriptions, how does it reduce costs? Does it? It must keep people healthier, reduce hospital costs. Tell us more about that.
We actually have seen research to that effect. To the extent that people are walking away from the pharmacy counter, which unfortunately is something that happens a lot when people are facing a high out-of-pocket cost, that could ultimately lead to higher healthcare costs down the road because you aren't treating the condition that your drug is intended to treat.
Mm-hmm.
And so we've seen research that shows and expects that because people in Medicare Part D will have lower out-of-pocket costs, they will take their drugs as prescribed, and that ultimately will actually lower spending in other parts of the Medicare program because their overall health will improve.
Hey all, Jonathan from Go2 Health. Let me ask, how do you sustain your energy throughout the day? I try to do it with the morning cup of coffee and then one in the afternoon as a pick-me-up, and of course my daily vitamins. But what if I told you I was trying something new that's working for me just great? It provides me with sustained energy and focus, with caffeine for alertness, but balanced by amino acids and taurine to prevent jitters or crashes. It also has a blend of B vitamins, L-carnitine, and choline to power my energy and mental clarity, even if I didn't get the best night's sleep. It's also packed with vitamins A, C, and E to support my immune health, even with my days of packed schedules. And it's sugar-free and what I'll call flavor-forward. I alternate between 3 delicious flavors: mandarin orange, mango strawberry, and fruit punch. Just 1 small scoop of mix in 8 ounces of water and I'm done. Boom, off to the races. This formula boasts 32 years of brand expertise and thousands of 5-star reviews from millions of users. And it's a woman-owned company. What's this product I'm yakking about? It's called Spark Energy Plus Focus from Advocare. Spark Energy Plus Focus. For Go2Health listeners, I've scored 30% off and free shipping. Go to drinkspark.com and use code Go2Health at checkout. That's code Go2Health at drinkspark.com. Let's tackle the day together with Spark Energy Plus Focus. Good. That makes a lot of sense, and I hope this continues. So I've created a special web link for you to remember, and you can go here to learn more. It's on the AARP website, but the link I've made is bit.ly/AARP drug prices. That's bit.ly/AARP drug prices, where you can learn more. So before we leave, Leigh, is there any more news you want to share with us? Because this is such good news today.
It truly is a day of good news. The one thing I would like to leave people with is the fact that this new out-of-pocket cap extends beyond the people who already are facing high out-of-pocket costs. Of course, it's going to help people that were spending a lot of money on their prescription drugs. But the reality is it's also going to protect everyone else because they are, frankly, one very expensive prescription away from needing that out-of-pocket cap themselves. So the fact that this is going to be in place in the Medicare program every year going forward is an important protection for absolutely everyone in the Medicare program.
And so how is that? I don't quite understand that connection. Can you explain that a little more?
Absolutely. If you were to go to your healthcare provider tomorrow and be prescribed a drug that is incredibly expensive that would lead to high out-of-pocket costs, and perhaps you didn't have those types of costs before, that $2,000 out-of-pocket cap will be waiting for you. So no matter what you're prescribed in the future, no matter how expensive it is, that benefit will be available and you will not have to spend more than that $2,000 in 2025.
Great. Okay. Now give me this headline one more time so people will remember. What do we want people to remember as they walk away from this interview?
I would love for people to walk away knowing that this cap exists. The reality is there is a lot of different changes that have occurred as part of this 2022 law, but this cap is a really big, important improvement and achievement. So to the extent that people out there are struggling with their prescription drug costs and they're in a Medicare prescription drug plan, please be on the lookout for this improvement because it is something that is going to save you a lot of money.
Great. And that cap will happen automatically, right? As soon as you hit it, the pharmacy will not charge you anymore.
That is correct. This is something that people just have to show up and fill their prescriptions, and it will happen automatically for them.
Beautiful. Good. Thank you so much for being with us today to share this good news. We needed it this time. We've been talking with Leigh Purvis. She is AARP's Prescription Drug Policy Principal, where she heads the organization's work on prescription drug issues and is a recognized expert on prescription drug pricing and coverage. Thanks for being with us, Leigh. It's so great.
Thank you for having me.
Good. We'll see you again soon. And as we say at the end of every show, remember, go to health. Take care. This has been Jonathan Marks with Go to Health Media. Bye-bye. Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life. Hey all, Jonathan from Go to Health. Let me ask, how do you sustain your energy throughout the day? I try to do it with the morning cup of coffee and then one in the afternoon as a pick-me-up, and of course my daily vitamins. But what if I told you I was trying something new that's working for me just great? It provides me with sustained energy and focus, with caffeine for alertness but balanced by amino acids and taurine to prevent jitters or crashes. It also has a blend of B vitamins, L-carnitine, and choline to power my energy and mental clarity, even if I didn't get the best night's sleep. It's also packed with vitamins A, C, and E to support my immune health, even with my days of packed schedules. And it's sugar-free and what I'll call flavor-forward. I alternate between 3 delicious flavors: mandarin orange, mango strawberry, and fruit punch. Just 1 small scoop of mix in 8 ounces of water and I'm done. Boom, off to the races. This formula boasts 32 years of brand expertise and thousands of 5-star reviews from millions of users. And it's a woman-owned company. What's this product I'm yakking about? It's called Spark Energy Plus Focus from Advocare. Spark Energy Plus Focus. For Go to Health listeners, I've scored 30% off and free shipping. Go to drinkspark.com and use code GOTOHEALTH at checkout. That's code GOTOHEALTH at drinkspark.com. Let's tackle the day together with Spark Energy Plus Focus.